Guys, welcome to another episode of House of Health podcast. As you know, we bring you lots of different medical topics and we try and debunk the science, make it very simple, and often have experts in different fields talking about different topics. Now, today, it's a very common theme, something that's being discussed on the internet, on social media, and really there's a lot of heat around this topic is the topic of ADHD. ADHD stands for Attention Deficit Hyperactivity Disorder. It's a neurodevelopmental disorder, which is very common. It's seen in around 5 to 10% of children and 2 to 5% of adults. And really, there has been a lot of push towards early diagnosis because it can really help people and children specifically who have ADHD. Today in the studio, I have Dr. Anita Raja. She's a GP and she has interest in female health, sexual reproductive health, and longevity medicine. And today I have her here asking some questions around ADHD. So Anita, hi, thank you very much for being on the podcast again.
Thank you for having me on.
I know you've been quite vocal about early ADHD assessments, and it is something that you are doing at House of Health. So tell us a bit about ADHD. Why is it important? And let's start with the traits. How does someone know that they may be suffering from ADHD?
So thank you very much for having me on. And when it comes to ADHD, I think one thing we've got to bear in mind is that there's a lot of misconception, a lot of myths which are circulating around different portals of the internet, social media, misinformation that is being spread. ADHD is a neurodevelopmental disorder, which is very common. It's one of the most common neurodevelopmental disorders. And it is not a phase, it's not a disease, but it's something that you have to live with for the rest of your life. ADHD brains are very unique, they're very creative, but having to live with a brain that is firing at 2,000 miles per second is difficult. So it's extremely important to get help at the right time. Now, when I was much younger, ADHD was something that was really rare. And, people used to say, well, this kid is naughty or this kid is not listening to instruction.
Disorganized, unmotivated.
Yes, lazy. Yes. But now that, time has progressed, medical science has progressed, there is a lot more acceptance around neurodevelopmental disorders. We've seen that ADHD is something that people are more accepting of as a diagnosis. Now, why is it important that we get the diagnosis at the right time? It's important because we want to get help at the right time. There is help out there in form of medication, in form of counseling, support. And also, if you get this diagnosis, you get support in a school setting, you get support at work, the people around you, your loved ones understand you a little bit better because, it's not one size fits all. And of course, ADHD has different variations in terms of symptoms. However, people with ADHD may be struggling with relationships. They may be struggling with keeping down a job. They may be struggling with their sleep. They may be struggling with their attention, keeping up with university work, schoolwork. And it's not that they're doing this on purpose. It's just because they simply cannot do it any other way. So it's important that we do help them. I genuinely think that ADHD assessments at the moment are taking much longer than they should.
What do you think is the average wait currently for people to be diagnosed with ADHD?
Wait is anything between 6 months to 18 months. Sometimes it can be up to 24 months before you even get to see a psychiatrist who's going to do the diagnosis. And then it can take another 6 to 12 months before you're actually commenced on medication. Because bear in mind, the medication that you are put on needs blood testing and ECG, and you need to be monitored quite regularly. So it's a very slow process. So at the House of Health, we've got 3 psychiatrists, 2 adult and 1 child, and we're very passionate about offering people the right help in a timely manner.
So I'll be asking you a few myths that our viewers have sent us, and these are common misconceptions. Often ADHD people are mislabeled as being disorganized and lazy. So the first myth is actually on that. Is ADHD just an excuse for being lazy, being disorganized?
Certainly not. You're born with ADHD, so your brain is very unique and your brain works really differently. And it's beautiful in its own way and in its own right. And you've got your own strengths and your own weaknesses, but you're not lazy because you cannot help putting things off because that's the way your brain is wired.
Another myth that people often say, and I've laughed at it because it's so funny, is ADHD is caused by bad parenting. If you're very strict with your children or if you give them too much sugar, ADHD can result. Is that true?
Certainly not. And I actually feel for parents who are blamed for bad parenting when it comes to having children who are not listening to instructions or hyperactive, running all over the place, climbing on furniture. Because I've seen around me within our friends' circle, within the circle of patients that we've got, that people have actually resorted to social isolation because they simply cannot bear taking their child out somewhere because they're worried about embarrassment, they're worried about judgment. Being the parent of someone who's got ADHD is tough. It's very, very tough because you sort of, you change your life, you change your relationships with other people because you want to avoid causing an upset. You want to avoid causing, inconvenience for other people because your child is different.
Some of the older generation may be looking at this, thinking that ADHD is often overdiagnosed. They seem to think that it wasn't a thing when they were young. Certainly when I was younger, we didn't have a lot of, children being labeled as ADHD. Why do you think it's being more talked about? Do you think that this has always been there and people have been not being picked up as having ADHD? What do you have to say about that?
I think ADHD has always been there. People have always been neurodiverse. I mean, people who've done great things, people who are geniuses, people who are entrepreneurs, think out of the box, are all people who have a different, unique brain because they want to go against the norms. They want to break the rules. They want to do something different, and they're daredevils. When you have ADHD, you're rather uninhibited. You are a risk taker. And people who've done big things, big inventions, look at Elon Musk, look at anyone around you, these are people who have done things differently because they are happy to take that risk. Now, when we were younger, I think there was lack of acceptance around ADHD, lack of understanding around ADHD. And I think now it's much more accepted. And if you are talking about neurodiversity, I think all of us are different and unique in several ways. And, most of us would have some form of neurodiversity, but it really depends on how it's affecting your life on a daily basis. If it's affecting, your relationship, if it's affecting you staying into work, if it's affecting your education, if it's affecting your relationship with your children, your friends, your loved ones, then it is a good idea to find out why you are a certain way or whether you've got a certain neurodiversity.
What happens if they're not diagnosed? So if this diagnosis is not done, what are the risks?
The risks are what we generally see in general practice. Certainly in my clinical practice, I have seen that when people are not diagnosed and they enter their late 20s to 30s, there is a risk of relationship breakdown. There is a risk of depending on things like alcohol, drugs, because they want to feel calmer. They want to slow down their brain. There is a risk of being out of job, being unemployed because, they tend to get into arguments with their boss. They don't take instructions really well. It is very difficult to live with a brain that has ADHD because you are struggling on a daily basis. Every day is a battle. And they certainly suffer with, psychiatric conditions like, anxiety, depression. So it's very difficult to cope in general.
Okay. Finally, if someone is looking for help, diagnosis, management, wanting to know more about ADHD, how can they get in touch with you or your team?
So you can go on our website. It clearly tells you who our team members are. We've got Chandan Aladakati and we've got Dr. Ishjuhi Sharma, and Dr. Gul has also, recently joined us as a child psychiatrist. And the idea is that we give you a timely diagnosis and help when you need it. Of course, if a diagnosis is warranted. And, we've got a WhatsApp line, we've got a telephone number, so you can always also contact us via email. It's hello@houseofhealth.org.uk.
What about ADHD in women? Because often it's men who are diagnosed with ADHD. What do you have to say about that?
So it's a very good question you asked that. Now, ADHD in men and women transpires in completely different forms. women are more likely to have attention deficit disorder, not the hyperactivity form, which essentially means that they are under the radar for a longer period of time because they're not causing any inconvenience to their parents, to their teachers, to their friends and family, and they're just a little bit inattentive. They may suffer for longer, and this essentially means that they get a diagnosis much later or may not get a diagnosis at all. Whereas in boys, we've seen that the hyperactivity part is predominant, which essentially means that, they're going to cause disruption in the house, they may cause disruption in school, and so it cannot go unnoticed. So I would completely disagree with the fact that women do not suffer from ADHD. They do, and they probably do as much as men do. But the only problem is that because it sort of transpires in a different way, the symptoms are very different, it may go unnoticed for a longer period of time.
That's great. Thank you very much. If you found this video helpful, please subscribe to the House of Health YouTube channel and hit the bell icon so you're informed of any new videos. We will be back. As you know, we're very passionate about different medical topics, and we always have experts coming into our podcast room. So I hope you subscribe and tell your friends about House of Health. Thank you very much.